Here we are collecting more interesting conversation about obesity, and now is the time to talk about our kids, our teenager. How is the situation and what are the treatment for them? So let me introduce you. He's Dr. Thomas Inge. He's professor of surgery at the Northwestern Feinberg School of Medicine in Chicago. Am I right?
You're right.
Thank you so
Thanks
much.
for having me today.
No, thank you so much. So I want to start because I want to ask you about the situation about our kids and teenager.
Sure. You know, the sad reality is the kids are getting heavier, and the problem that we've noticed that began in pediatric obesity in the 1980s is only getting worse decade after decade. In fact, in the last 15 years, Journal of the American Medical Association just published the latest finding, and we find that 2% of our kids are severely obese in America. And these kinds of weight gain that they see are causing health problems that we have to treat now more and more frequently, very aggressively.
Why? Why the situation is getting worse?
Yeah,
What are the causes?
That's the million-dollar question, of course, is why and how. We certainly know that there's less opportunity for physical activity. We think that lifestyle habits are somehow also contributing. We understand that ultra-processed foods in our environment are certainly causing problems. Fast foods that are tasty, easy to ingest, a whole day's worth of calories in one meal. We also know that there's environmental toxins that are ever present in our environment that we all have that tend to cause disruptions in weight regulation and other endocrine disruptions. So I think that it's a multifaceted problem.
What happened with the kids? Because kids have to run, have to play outside, but they are playing in the tablet, video game. Is that another problem? What happened with the screens?
I think it's a big problem.
It is.
It is. And whether it's, sedentary behavior, in other words, just sitting around and playing on the screens, or whether it's the effect of the screens on disturbing their sleep at night, we do know that sleep and healthy sleep is really important for healthy living and healthy
and
weight
to grow.
and growth. So again, I think that you really have pointed to one of the big problems is social media. Part of it is its screen time, and all of the screen time. I think we don't know what's mostly responsible, but it's certainly all of the above.
What are the risks of the obesity in that age?
Right. So I think that one of the biggest risks, actually, that doesn't get a whole lot of talk is the risk of not being able to lose it, the risk of becoming even heavier and heavier as an adult and having a shorter lifespan because of it. The obesity does tend to be associated with high blood pressure, other cardiovascular risk factors, including high levels of fats in the blood, atherosclerosis. Perhaps one of the most devastating problems is type 2 diabetes. Type 2 diabetes is developing along with this epidemic, and probably in part due to the epidemic of obesity. And type 2 diabetes is another one of the diseases that causes other diseases. It causes blindness, it causes kidney failure, it causes problems with your circulation, so you lead to amputations, and cerebrovascular problems. So these problems are starting in our kids as young as early teenage years, and we have no effective treatment, medical treatment, for the type 2 diabetes in this age group.
What happened beyond the physical problems related with the obesity? What happened with the social and psychological situation with teenagers?
Yeah, it depends.
A very vulnerable age.
It's a vulnerable age, and we understand that the stigma that goes along
Stigma.
with weight can be a very powerful problem that our youth face. The kids get bullied, they get made fun of. Many times they are carrying around anxiety and depression that is because of this stigma. And many times it causes them to even not even go to school.
Oh.
So the problems that we can see, with this are many, from a health standpoint as well as a social standpoint.
What are the solutions? So let's talk about the treatment. We have different kind of treatment, surgery and different drugs. I'm thinking about semaglutide, Ozempic, Wegovy.
Right.
So can we treat our teenagers or kids with those treatments?
Absolutely. I do think that no conversation about treatment really should be discussed without talking about the lifestyle. All of the things that we talked about first, all of the factors that we think lead to the obesity problem have to be addressed in the home. That includes good nutrition counseling, making sure that they're minimizing the ultra-processed foods, eating healthy, organic, and raw vegetables, raw fruits. Cooking at home is one of the fundamental things.
Yeah. You have to process your own food.
You have to process it in your own kitchen. Yes, that's right. But beyond that, good sleep-wake cycles, minimizing the screen time. Everyone is going to get screen time, okay? But it's got to be something that we, that we manage and do that smartly. I think that beyond that, healthy activities, play, the 150 minutes of moderate physical activity per week so that you can actually get your heart rate up. These things we cannot forget are part of a treatment, while all the while looking at what is the outcome. If you cannot get control of that obesity problem with these first level interventions, then I believe that we have to use effective medical therapy. So the medical therapy that you talked about today, we've gone through 3 phases now, of the minimally effective drugs, the medium effective drugs, and now we have some really quite effective drugs. So I do think that there's a role. We're understanding there's a role for surgery as well, but there's a role for medications in certain individuals. And I do think that there's parental choice, there's child choice for children that are old enough to make decisions on their own, and that's most of them that need aggressive therapy. They're in their teenage years, and they should be making decisions on their own, at least in strong partnership with their parents. So I think medications should be considered now that we have effective medications, as well as surgery.
As well as surgery.
As well as surgery.
Oh, wow. So it's any risk to do the surgery in our kids or teenager?
I think there's risks every time we get up in the morning. Every time
we know.
Every time we go out.
When you cross the street.
You cross the street, there's risks. You have to look at the risks and the benefits and weigh them. Exactly.
Because obesity is a risk.
Absolutely. The risk of not doing a treatment is an absolutely valid way to look at it and balance the risks. So yes, there are definitely risks of surgery, and we have studied outcomes of surgery. We've studied outcomes of different operations. We think that the different operations have different risk profiles. Right now we're using mostly sleeve gastrectomy for teenagers that have not been successful with lifestyle interventions and any other treatments that we've offered them. Most of the teenagers that we're treating with surgery, we have already started nutritional, lifestyle, and even medication interventions in an effort to get their weights down to a healthier weight for surgery. Many times I'm seeing patients with 150 or 200 kilograms. That's very high.
It's very
So getting them to a body mass index or a weight that is safer for surgery is my objective in many of those cases.
So we are talking about kids, about teenagers, but we have two problems. We have to face two situations: the obesity and prevention. What do you think about that?
Yeah, I think that prevention comes in different flavors, if you will. So for many, many decades, we've been talking about prevention of obesity. We have no strategies that prevent obesity that are effective at preventing obesity. We can talk about then secondary prevention. So my thought here is that we need to be preventing the health problems that can come with untreated obesity.
Yeah.
And those health problems are fatty liver disease. We're understanding more and more that the kidney is insulted and is damaged by obesity. We certainly know that sleep apnea damages the heart as well as causes more stress on the liver. And we understand that the complication, again, that is front and center is type 2 diabetes because it's such a devastating problem. So I believe that we should be thinking more about secondary prevention. So prevention of those problems that we know with good treatment, we can prevent the health problems.
Yeah. We have a responsibility as an adult and also as a parent. And I know that this is not medical, but when I was a child, a teenager, many, many years ago, I was playing outside. I was running. We played a lot of soccer here in Chile, as you know. So my friends, they were playing soccer outside. Now kids are playing soccer in the consola and PlayStation. So we have a responsibility too, because kids are kids.
Yeah, we can't be playing the soccer on our phones.
Yeah.
This is no good.
This is not good.
No. We have to have safe places to play.
We have to have safe places.
That's right. We have to be able to get back to a point where we're no longer negotiating for that space and no longer negotiating for healthier foods.
But it's difficult to access to healthy food.
It is very difficult, and it's part of what makes parenting in this era so important and so difficult, because there are so many threats, if you will, to the health and well-being of our children. But I do think that parents need to play a role, and need to educate the kids, and need to begin doing that very early on. I think that there are a lot of parents that don't take that responsibility as seriously as they should.
Yeah, that is a big point, because I was talking with a cardiologist, and he said, you cannot eat a hamburger as an adult if you have a child. It's a family problem. We have to do this together. We have to change our habit all together, parent, kids, etc. So what is I don't have that much time, but what is your main message to our audience?
I think it needs to be, we can look at everything that we do as doctors, everything that we do as parents, and realize that fundamentally we are facing a very difficult problem. I'm not saying that we cannot have a soda, we cannot have a dessert. I'm not saying that. I think that we have to approach this reasonably and have reasonable limits to things that we know are harmful. And we need to get back to the nuclear family and be able to sit down and eat together at least one meal a day and eat slowly.
Eat slowly.
Eat slow, like the Europeans and the
Yes,
South Americans,
they know.
right? And get back to healthier habits.
Together.
Together as a family.
Yeah, because adult people have, most of them have obesity too. So we have to fight all together.
It's a family problem.
It's a family problem.
That's right.
Thank you so much.
Well, thank you. What's your name again?
Macarena Morales from CNN.
Margarita. Very nice to be with you today. Thanks for having me.
No, thank you, and another interesting conversation. See you at the next one.